hand is to look at the dura which is covering the brain. Look for any blood on the external aspect as well as reflect it and examine the under surface of the dura to look for any membranes or blood clots. Do the same thing on the opposite side as well. You can see that it's a very smooth, shining membrane and there is no blood collection in the subdural space. Now, once you have done that, the next thing you need to do is to open up the superior sagittal sinus that you are seeing here in the midline. To do that, I am going to use a scissor. Lift this up. This is where the sinus will be located. And I am going to open this up. Presence of any venous thrombosis. So prise it open. You can see that the superior sagittal sinus, which is here, is completely patent. Once you've examined the entire superior sagittal sinus, you can tear off the dura. Now you can see the two cerebral hemispheres. The first thing that you look for is whether there is any asymmetry in the size of the two hemispheres. Here you can see that it is fairly symmetrical. The next thing you need to look at is the coverings of the brain. So these transparent coverings you're looking at is the meninges. So look carefully to look for any blood under the arachnoid, that's the subarachnoid space, any subarachnoid hemorrhage or any exudates. Here you can see that there is a patchy subarachnoid collection. We call that as a subarachnoid staining, but there are no exudates. The next thing you have to look at is the gyri and the sulci. Here you can see the gyri are very prominent and the sulci are very deep. So this tells you that there is no cerebral edema. So very prominent gyri and deep sulci means that there is no cerebral edema. All of these are the congested veins that you're looking at, which is a post-mortem change. Now once you've looked at that, the next thing you look at is the structures at the base of the brain. So the base of the brain is what houses all of the critical structures like the cranial nerves and the cerebral vessels which form the circle of Willis. These two are the olfactory nerves that you're looking at, and this is the olfactory bulb. This is the optic nerve joining to form the optic chiasma. Below that, these two are the oculomotor nerves which are coming out between the two terminal branches of the basilar artery, which is the posterior cerebral and the superior cerebellar artery. Between the two is exiting the oculomotor nerve. Now if you need to see the trochlear, you've got to look at the other side, because the trochlear is the thinnest nerve and it's what exits from the dorsal aspect. So what I'm holding here is a very thin trochlear nerve. And you can see the same thing on this side. This is the trochlear nerve. Now once you've seen that, this is the pons, this is the bulbous pons, and at the mid-pontine level, this thickest nerve that you're looking at is the exit of the trigeminal nerve on both sides. And at the junction, which is the pontomedullary groove, you can see the sixth cranial nerve emerging on both sides. Now a little more laterally, this is the foramen of Luschka. At that point, you can see the 7th and 8th nerve complex which is coming out. Now for the remaining cranial nerves, if you look at the lateral aspect of the medulla, that's the pyramid, that's the olive. Behind the olive are the rootlets of the 12th cranial nerve. These are the rootlets of the 12th cranial nerve. The 9, 10 and 11 will come between the pyramid and the olive. We then examine the vessels of the circle of Willis. Starting with the posterior circulation, these two are the vertebral arteries joining together to form the basilar. You can see the basilar dividing into its two terminal branches. That's the PCA and that's the superior cerebellar artery. You can see the same thing on this side. Now the anterior circulation has the internal carotid arteries on both sides. Emerging from that is a middle cerebral artery which is running into the sylvian fissure here, and that you can see on both sides. Anteriorly, you can see the anterior cerebral arteries originating and entering into the interhemispheric fissure. So you can see the ACA is entering into the interhemispheric fissure. The ACOM connects these two, and here you can see the PCOM, which connects the ICA to the PCA. That completes the circle of Willis. Once you have completed the circle of Willis, you should look at the other structures that are seen. So just to quickly go through, this will be the optochiasmatic cistern which surrounds the optic chiasma. This will be the interpeduncular cisterns, because on either side you can see the crus cerebri or the cerebral peduncles. Within this you can see the two mammillary bodies, and this is the stalk of the pituitary. The cistern that covers the basis pontis is the pontine cistern, and the cistern that surrounds the medulla is the cisterna magna. And now I have lifted up the medulla for you to be able to see the opening of the fourth ventricular cavity. So you need to look at whether there are any basal exudates that are covering the surface of the base and obscuring the contents of the base that I just showed you. Here it's very clean, and that's why you're able to appreciate all the structures at the base of the brain. Now you need to also look for evidence of herniation. How do we do that? There are two things we need to look for. One is uncal herniation and the other is tonsillar herniation. We'll start with tonsillar herniation because in this specimen it is easy to visualize that. Now these two structures are the cerebellar tonsils. Now in the event of raised ICT, there is going to be descent of the cerebellar tonsils through the foramen magnum, and the foramen magnum will groove the tonsils to make a very deep impression, and that's what you're looking at here, and this is what we term as tonsillar herniation. A similar thing we look for in the uncus. Uncus is the medial-most portion of the temporal lobe. This whole thing is the temporal lobe, and this is the medial-most portion. Now this is where the tent will get inserted on this side and this side. So if there is downward displacement due to cerebral edema, the tent is going to groove the medial-most portion of the uncus. So this will then project into the cistern, and that's what we term as uncal herniation. Here you can see that the uncus is well rounded and not projecting in. There is also no groove on the uncus to say that there is uncal herniation.